Hello and welcome back. This is our week 3 video. We're going to be covering the axial skeleton. I'm super excited to dive into this with you all. As the time you're seeing this recording, you've probably already started doing your drawing the skeleton activity in class, and you'll probably be working on that for 2, maybe even 3 weeks. But this is just a video to kind of talk about what kind of things we're looking at when we look at axial skeleton. When we wrapped up bones, we talked a little bit about the 2 different types of skeletons we have. We have the axial, so that consisting of the cranium, the head, the vertebrae, meaning our spine or spinal column, the sternum, which is this front bone right here at the center of our chest, and then the ribs. Obviously, the ribs wrapping around, holding in our lungs and a lot of other vital organs. But that is what we're going to be talking about in week 3. We're also going to be talking a little bit more about movement that we will be seeing over the next 4 weeks or so, even as we get into muscles and everything. And then we'll also talk a little bit more about some joints. We talked a little bit kind of about like what kind of things make up joints, specifically like cartilage, as we talked about in week 1. But this video will really dive into how that actually works. So without further ado, let's go ahead and get into it. Alright, so we're going to talk about some movement terminology to begin today. You don't need to know all these terms right off the top of your head, but as we get later on in the semester, these terms will become more familiar with you all. There's a diagram here to the right to kind of show you the things we're talking about. But when we're talking about flexion, we're obviously talking about... So sorry about that. So when we talk about flexion, we're talking more about the decreasing of an angle. So we think of things relative to our arms being in anatomical position. So arms are by our side and we're performing flexion. That is bringing our hand up. So we're bringing our hand closer to our shoulder. That would be an example of flexion. While extension would be the opposite. It would be going down and increasing the angle of our elbow. Hyperextension, meaning abnormal increase. So we don't want that to happen. It is possible for them to hyperextend. In fact, you probably know some people that can hyperextend, or they're double jointed, you could say. That would be an example of hyperextension. Abduction and adduction, they're opposite terms or antagonistic terms. Adduction meaning to move towards, so we're adding to the midline, while abduction meaning to move away from the midline, so away, and then there's add back to the midline. Supination and pronation refers a lot to the hand. It can refer to other things, but we mainly think of the hand and forearm. Supination meaning like you're holding a cup of soup up, so that'd be palm up, and then pronation being down, so we're pouring the soup out, so pronation is down. So supination, pronation, and then elevation and depression. The main 2 terms we use for those are the scapula and the shoulders. When we breathe in, we go up and we elevate our rib cage actually. So we breathe in and then we depress it and we go down. We can also control that using some of our back muscles as well. So we can elevate our shoulders and lower them when we shrug. And then rotation is pretty self-explanatory. It means moving around an axis. So things like our wrists, they move around an axis. We'll learn more about that kind of joint as well. There's also another kind of movement called circumduction, which means you can move in a circle, which isn't really rotating as far as it is that extended region is able to make a circle in its movement. All right. So now we're going to dive into some of the bones and joints. There's 3 main types of joints. There's fibrous joints, there's cartilaginous joints, and synovial joints. We talked a little bit about fibrocartilage in week 1, mainly it being super strong, consisting of a lot of collagen fibers, and it's leucinae, those little bubble clusters, kind of sporadic everywhere. It's also kind of a distinct blue color of them under the microscope, but it's a joint that particularly has no movement. And when we think about no movement, it kind of seems counterintuitive with the joint. We have something that helps us move, but it doesn't perform movement. Well, if you remember last unit, so back in week 2 when we talked about bones and bones growing, we talked about this one type of bone growth called the fibrocartilage model. And that is a kind of model that we're using here in these kinds of joints. So these joints only exist for a temporary period of time, especially when you're very, very young and you're trying to fill in with bone. So these joints, you do not have your entire life. They typically only last for a short period of time, and they're typically a little soft. They give us some ability to flex and absorb, especially like when a child is giving birth. Their head is typically the largest portion of their body. So it's kind of important that they have a little bit of flexibility in the skull so their brain doesn't get damaged, but they can also squeeze out. Cartilaginous joints, they provide little movement. The main one is the pubic symphysis. So I think the other side of things like birth, this is the common example used for it. It connects the two sides of your hip together, so it can expand a little bit and actually help women give birth a little bit easier, but it still does not have a lot of movement, and it's very, very tightly connected between two bones. Now, synovial joints is the actual kind of joints that when we think of joints, we're referring to. They're helping in the facilitation of movement, so they're contributing to that free movement. The interesting thing about these, as we see over here in this diagram, is that they do have ligaments on both sides. They have this articular cartilage, which helps the bones not rub together so much, and it creates a smooth surface for them to do so. But you also have the synovial fluid. When we talk about things like arthritis, it typically occurs in this area, but the main thing to keep in mind here is that this area is actually filled with fluid. Then we have our spongy bone or compact bone like we learned about as well. Alright, so within the synovial, so I'll go ahead and break it down for you. We had our 3 types of joints. We have synovial joints, our fibrous joints, and our cartilaginous joints. And within the synovial joints, we have 6 other types of joints. And they're all referenced here in this diagram. There's another slide, I'll walk you through them all. But the ball and socket, the main thing I want you to think about with ball and socket is that this is the most movement. So there's no other joint in the body that provides as much movement and free range as these ball and socket joints. The 2 most common examples are obviously the shoulder and hip. If you're just sitting or standing watching this video, you can go ahead and play around with that. You can move your arm in many different directions. You can elevate it, depress it. You can even make full circles with it, so circumduction. But that's the main thing to think about here, is that there's not really any limitations. And it exists in this ball and socket kind of fashion. So we have the ball, like our femur here, and then a socket, which it goes into, so this caved out area, and that's what helps provide the movement. We have condyloid, which is kind of similar to that ball and socket, except it's only helping us change the angle of something within a fixed area. So think of like that socket, but going higher up. So it can't make that full movement, but it can still bend and increase the angles from different directions, kind of like so. And the wrist is that main area that does it. So we can't necessarily make like a full circle with our wrist. We can get really close, but then it has to like kind of leach back over. The gliding joints, those are pretty common within the bones of our hands. So it's not as much about changing that angle as we think about. So it's not like moving back and forth, but rather it's an actual gliding plane. So the 2 bones are fixed on top of each other, and it's providing little movements to help them move across planes. So pretty self-explanatory. So here's the other ones. We have the hinge joint. The most common example is the elbow. When we think about the elbow, it can increase and decrease its angle, but it can't really move side to side. When we think about it moving side to side, kind of in the fashion of abduction, so moving out and adduction, moving in, like so, it's actually the shoulder doing that motion for us, using its back muscles and our pec muscles antagonistically to help make that movement possible. But it's in a fixed plane, and it's flexing and extending. The pivot joint, the neck is a very common one, so it's not actually increasing or decreasing angle or causing elevation or depression, but it's a fixed point that's allowing rotation of another point. So being able to shake our head no, that's a pretty common example of this atlas axis connection. and then being able to go yes. That's more of an example of the other spine curvature functions, but mainly the ability to shake our head no is the example of a pivot joint. The saddle, as you can see here, is pretty common with our thumbs. So it kind of sits right on top, but it also has a lot of ability to move. So we can flex and extend our thumb, but we also have kind of some circulatory movement, but we can't elevate and depress it. That's actually this knuckle right here being able to do that. So that's our example of a saddle joint. Alright, so now we're going to move on to the axial skeleton. Again, the axial skeleton consists of our cranium, vertebrae, sternum, and ribs. So I'll go ahead and write those out. So we have our cranium, vertebrae, sternum, ribs. That might be important to know for an exam. Hint. So here's some of the features when we talk about bones. I know it's a lot right off the bat. You don't have to know all of them. You'll become familiar with them as we go on, but as we talk about the bones and the bone landmarks later on, you can refer back to this to kind of say, oh, that's what the definition of that is. A lot of it is self-explanatory. So when we talk about things like a fossa, that actually comes from the Latin word for valley. So you can think of it as a shallow depression. Some more common examples are the spine, which is kind of that slender projection, just like our actual spine. And that typically is a pretty compact area of bone as well. But you can just refer back to these later on as we go on. We'll see them a lot. Don't feel like you need to know all these terms right off the bat. Alright, so let's talk about the skull. When we talk about the skull, there's 8 cranial bones, and there's going to be 14 other facial bones, which we'll cover in the next slide. But the important ones to know here are our frontal bone, temporal bone, parietal bone, and our occipital bones. The only ones we have 2 of are our temporal and parietal, as we can see. We should also have 2 occipital bones. I'm not sure where that is. I'll go ahead and write that here for you. So we should have 2 occipital bones because those are going to make up our occipital. Think of occipital, think of the ear region. And then obviously we have our frontal and then our parietal on the sides. Our fontanelles, as we talked about earlier, these kind of joints that eventually get closed in by bones, follow these kind of weird suture lines right here. So that's where all those little fontanelles exist, and then they fill in and cause those like weird suture lines later on as we get older. Here are our facial bones. The important facial bones to know here will be our zygomatic, our nasal, our maxillae, our mandible. Our mandible is going to be pretty important to know as well. But these are bones that are pretty observable when we're looking at our own facial structure. So the mandible is our entire jawbone that connects at this thing called the temporomandibular joint. So it connects our temporal lobes, so these side lobes, to our jaw right here. And it's very, very deep. You can kind of feel it, especially if you open and close your jaw. That's called the temporomandibular joint, but that's a way to think of them together. There's a maxillae, which is kind of this front bone that has our top row of teeth, and then our zygomatic bones, which are this entire region right here that connects our frontal and our occipital lobes, and that has this thing called the zygomatic arch right here, which is a pretty distinct jawbone feature. It kind of gives us our cheekbones. And then we have our nasal bones, which is right here. There's no bones right here on the tip of our nose. Obviously, that's cartilage, because we need it to be flexible. But there is a small bone right here called the nasal bone. Here are some of the things that you're going to want to know for your quiz. I'm obviously not going to quiz you on all of them. Also, as we're working through this, I'll tell you this in class in case you missed it, but as we're working through this, I will give you your in-class skeleton drawing for your quiz, which will have some of these features. So it might be important to go ahead and try to draw out all of these features if you can on your skeleton. So keep that in mind. but this is a good list to go ahead and refer back to. But this is just to kind of show you all that there's a lot of features on the bone. Try to just review them and understand where they are. I don't really care that you memorize all of them as much as I do you know the terminology. So we talk about things like a foramen. I'll go ahead and underline that. Foramen, just the basic definition, is a hole in a bone that helps provide a nerve or a blood vessel to go through. So you'll see a lot of those, especially right here on the jaw. You'll have our mandible foramens. The foramen magnum is a pretty big one as well. That's actually where the spine goes through into the skull and helps it connect. So that might be an important one to think about and remember. But we also have a lot of other processes here. Sorry, not processes, features, but when we talk about processes, funny enough, a process is going to be something that sticks out. And we'll see those in a lot of other bones. But just kind of try to know the terminology. If it says infraorbital, obviously it means below the orbital, orbital meaning eye. If you know kind of the basic terms, you should be able to be just fine on your quiz. Alright, so let's move on to the spinal column. There's not much to know here, but there's 33 different kind of spinal structures. I want to see if I have this up here on the next slide. Yeah, okay, so I'll save that. Okay, sorry. So there's 33 different types of spine. Most of it is a repeating structure. We'll see a lot of very similar structures, especially here. We'll see these things called facet, which are these smooth areas for these joints and a disc to kind of sit, so that the movement is very smooth and fluid, and there's not a lot of rubbing of the bones, because when the bones rub together, the spine collapses. If the spine collapses, then your spinal cord gets crushed, and that's obviously not very good. So those will help facilitate kind of that clean movement. There's also a lot of these things that stick out, which kind of help these blood vessels and other muscles connect. So if you look at these holes right here, these are foramen. These are transversum foramen. They help carry blood up and down. So there's arteries and veins that run through there up and down. It goes to the head and other parts of the body to kind of facilitate movement. There's also these processes right here. These provide a little extra protection. And then there's these little facets right here, which will help connect with the spine above it or below it, depending on which way we're looking at it. We're looking at it from above, the superior view. So this will help facilitate the movement right over here, this facets for dens. That's about all you need to know here. I mean, the basic structure of the spinal column is to help provide support and protection. That's a kind of a common feature of all bones. So if you know what bones do, you should be able to know that. And then obviously the repeating units provides a little bit of movement and flexibility. So just write repeating units. Provide a little bit more of that movement and flexibility. But then the vertebral discs also provide that cushion as well. The fibrocartilaginous cushions, to be specific. The entire vertebrae makeup, so the kind of the spine makeup, is right here. We have our convex curves, and then we have our concave curves. So this is obviously bump is front, so that means it'll be convex. I'm sorry, I should say convex. C-O-N-V-E-X, convex. This one should be convex as well because it's curving into the body. And then this would be an example of a concave because it's curving out. The easiest way to remember it is the times of day that you have your meals. So if you're cervical, it's breakfast because you have breakfast first, going from top down. So you have 7. If you're thoracic, you have that at lunch. So then you have lunch at 12. And for dinner, you obviously have dinner around 5. And then the sacral and coccyx is 4 to 5, but it's all fused together, so it's really hard to kind of tell what you're dealing with here, but it fuses into the pelvic region and it also fuses together. So when we talk about the vertebrae, we still consider it because it's all technically that repeated units, but it's connected there. All right, let's talk about vertebrae. These are kind of the basic structures as vertebrae that I kind of talked over. Sorry that the image is a little blurry. But the important things to know is that we have this body right here. This is where the part of articulation, so the part of touching and rubbing, is most likely going to occur. Then we have these facets. These are there for the facilitation of movement. Our vertebral disc will sit on top of this body, but there can also be some extra cartilaginous tissue on these processes and facets, so these smooth white areas. Then there's obviously these which help provide anchors to the bones, so these transverse processes and this spinous process help with the muscles that run along the spine and helps anchor them down to keep them in place. So the important things to kind of know here, we'll have our body, spinous process, transverse process. Our facets will be pretty important to know. And that's about all. So going on to the ribs, there's three main types of ribs. There's our true, our false, and our floating. When we think of true, that just means that they're actually doing what ribs are designed to do. So that means they're connecting from the spine on the very back, and they're wrapping all the way around, and they're connecting to the sternum. We'll talk a little bit more about the sternum in a second. But all ribs have these basic functions. There's the there's the ribs. They'll have the body, which is basically that long portion, and then they'll have a neck, which is the portion that attaches to the back, but it's not here in this diagram. That's okay. So true will be our first 7. So 1, 2, 3, 4, 5, 6, 7. We can see that 7th one kind of runs up and attaches to the sternum still, so it's fine. Then we have our false, which is our 8 through 10. Which is these right here. So they're connecting to that 7th to get carried up and connect. So that's what makes a false. And then our floating 11 through 12, you can see them way down here. They just don't touch at all. So still important for that protection, but they're not as important because we want to be able to have some movement kind of down there. And if we had them down there, it wouldn't be that possible. But the important thing is that it cages things in, especially those vital organs, so it's extra protection, and that also provides a little bit of movement, because this white portion that connects right here, that is more cartilage. And that cartilage allows us to flex and bend. I'm not sure you've ever been like stepped on or like had something knock the wind out of you right there in the sternum, but it's kind of important that it caves in a little bit. It provides some shock. So that way, if something hits there that's of hard impact, it doesn't just crush right through and impact your vital organs. All right, so last but not least, we have the sternum. There's a few important features here. One is this body. We kind of saw it on the last diagram. It's where most of those ribs connect. But actually up here at 1, this little area right here, we call that the clavicular notch. That is where our clavicle extends across our torso. It connects from our shoulder all the way to right there. We can kind of feel that joint right there. We call it the sternoclavicular joint. If you touch, trying to figure out how to describe it. If you touch that top of your sternum, you'll know what it is because it'll go from your neck to a very hard portion in the center of your body, and then you'll go over just a tiny bit. You'll feel this weird little notch, and that's the joint. That's the sternoclavicular notch. Especially if you move your arm, you can kind of feel that joint working and moving. It's actually one that pops out of place pretty often, so if you've had that happen before, you obviously know what it feels like. With the xiphoid process, which provides a little bit extra protection as well, and then we have this jugular notch, because the jugular will start getting into the neck region, and this allows us to move our head forward and backwards a little bit easier. I think that's all I have for you all. So hopefully you learned a little bit something about the structure of the axial skeleton in this video. You learned a little bit more about the types of joints we have in the human body and the types of synovial joints that are important in our large degrees of movement. And then you also learned a little bit about the types of movement that our body can undergo.